How can surgical prosthetic tilted implant protocols help you treat dentaless patients with different degrees of atrophy? To address that, we have developed our full tilted implant hybrid course. It's a hybrid course because it's available on demand and live to explain to you step by step how to treat dentaless patients. The first module in our course will explain and clarify all of four original protocol described by Paolo Malo in 2003 for the mandible and in 2005 for the maxilla. And then we will discuss the V2V protocol, when to use the all-on-4 and when to use the V2V protocol. These protocols will be analyzed and discussed on cadavers with the possibility for you to learn the tips and tricks for the best implementation of these protocols. There will be the all-on-4 and V2V protocols adjusted to new techniques. For instance, for the transsinus technique, where transsinus implants are placed through the maxillary sinus when there are severe anterior pneumatizations of the maxillary sinus in the canine or second incisor region. And we will also discuss the transcrestal technique that our group has published. It's a technique through the crest where implants will be distomedially and also palato-vestibularly tilted, so as to make the best use of the little available bone in posterior regions. All of that will be clarified using cadavers and videos to provide examples of these more challenging techniques. In the third module, we will be talking about the zygomatic implants. We need to understand the state of the art in zygomatic surgery, starting from Breinemark's protocol, looking at the various contributions provided by Aparicio, Stella, Malo, and also by our group. We will explain in detail when this protocol should be used for placing zygomatic implants. These implants are very trendy nowadays. You're not regarded as a good surgeon if you don't place zygomatic implants. We have been doing that since 2006, and we are well aware of the complications which are sometimes associated with zygomatic implants. In our video course, we will also present the complications. In the third module, there will be a lesson on cadavers, which will allow to see in detail all the anatomical landmarks and boundaries. We will look at the orbit, the zygomatic body, at the infraorbitary emergence. When you place zygomatic implants, it's very important to have a clear idea of where the implants are being placed. The fourth module is fully devoted to prosthetics. We will be talking about provisional and final prosthesis, and most especially the pre-surgical prosthetic planning, which is extremely important. When you start surgery, you need to have a clear roadmap. So step by step, we will identify all aspects in temporary and final provisionalization, including also the lab phases that are sometimes neglected. Our full tilted implant hybrid course will also be enriched with new protocols. We will be talking about the treatment of perioral tissues. Thanks to the contribution of Dr. Ezio Costa, we will see how perioral tissues can be treated and improved in our older patients. improving their trophism so as to further improve the aesthetic outcome in our patients. We will be talking about new prosthesis with perfect placement, and on the top of that, we will see how we can improve the quality of perioral tissues. There will be a cadaver session, and there will also be some theory. We will discuss about the use of botulinum toxin and fillers to attain the target of improving perioral tissues. Our new live and on demand course will be held in Italian with a translation into English. Hope to meet many of you on osteocom for our full tilted implant hybrid course.